I've had several patients actually. I remember one of them, she had this tooth like on the upper left side, is a lateral. And every time she comes to my office, I tell her, you know, you have an infection on that tooth because it seems like the space is getting bigger between the two teeth and it's moving. And I take an x-ray and I see that there is like a lot of bone loss, and I measure it and it's measuring 6-7 millimeters. So I keep telling her that, and one time she comes in and the tooth has really moved out and you can see the big space between the teeth, but on the x-ray it looks like the pocket is around 10 to 12 millimeters. So it's basically gone all the way to the end of the tooth. So I know she doesn't have a lot of money, and even in a case like this, when you lost a lot of bone, in order for you to put an implant, you're going to have a lot of surgeries. You're going to have the tooth out, you're going to have bone graft, and the bone graft, first bone graft doesn't work, you're going to need another bone graft, you're going to need soft tissue graft, and you're going to need to place the implant, you're going to need to restore it. So that's a lot of work and may not be very predictable in this case because the bone loss would be tremendous. So I suggested to her, like I was suggesting to her, to get the LANAP done. And the tooth moved because there were other teeth hitting it. So when we are doing LANAP, we have to check the bite too and make sure the bite is good and adjust it if we have to. Because it's like the bone needs to heal around this tooth. If you keep moving it around, the bone will never come back because it's pushed away again, back and forth, and it's not going to come back. So I went in and I actually did the LANAP for her, and I pushed the tooth back with my tool back into position, and I put it back in its original position. And I did the LANAP and I connected the tooth, I splinted it with other teeth so it doesn't move. And the patient now, if you look at the x-rays, she had 10 millimeters maybe, and now she has maybe 3 or 4s in that area, and the bone looks like it's almost completely full. She never got a setback. I'm very happy because the bite worked very good and she's very, very pleased. That's been like around 5 years now with this case.